Hey y'all, it's Zoe here, your nutrition peer, back here at Nutrition Prep Notes with another prep note for you. And in today's prep note, we're going to be talking about how to answer multiple choice questions on the CNS exam. Stay tuned. Okay, y'all, we're going to go ahead and just dive right in. As always, my videos are for informational and educational purposes only. These are strategies and tips that I have for you that, from my perspective as one of your peers, will really help you in preparing for the CNS exam. So, as with everything, it's important to make sure that you personalize this process to you. Every one of us is a different test taker. Keep those things in mind. The tips and strategies that I'm sharing with you, I believe, are adaptable and can be customized to your own personal style. And so that's why I'm sharing them with you. I just did want to say that. And then also make sure you grab a paper and a pen and something to take notes with, because not only will I be sharing strategies with you, but we're also going to work through a few practice questions. So you don't want to miss this. Make sure you have something to write with so you can jot things down. And without further ado, let's get started. Okay, let's talk strategies. So strategies on approaching multiple choice questions. And so the first strategy I have for you is to really make sure that you read the entire question from beginning to end, and then really make sure that you understand what the test writers are asking you. It's easy for any of us to go in or to approach a situation, even a test question, with a certain level of bias, sometimes thinking maybe we already know the direction they're going or what they're asking. But really try to make sure that when you're approaching these questions, take them at face value and allow it to always be a fresh experience for you as well. Because for the CNS exam, it is not a traditional standardized exam. I wouldn't even describe it as a standardized exam. If you've seen any of my other videos, we've talked a lot about how the exam is created as the result of a job analysis study. So the exam is testing your ability to be able to perform and be knowledgeable of nutrition foundations and the competencies outlined on the content outline. And so the test wasn't designed to trick you. So make sure that you're reading the question from beginning to end and make sure you really understand what you're being asked. Now, you have some who may suggest that you read the end of the question and then go back to the beginning. I really recommend that when it comes to answering questions, that you read the question from beginning to end and then take note of keywords and different things that you see throughout there. The second strategy that I have for you is to annotate the question. And I put this as optional, but I want you to think about what you know about what you're being asked. So, and I put this as optional is because during your test prep time, it's going to be a lot easier to do this versus on actual exam day. Now, on exam day, you should receive a piece of scratch paper. I'm not sure if they'll give you any more after you use the one, but at the test center, you will get a sheet of scratch paper. And it may not be the most effective use of your time for every single question to annotate or make little notes about the question. But for ones that you may get stumped on, this is very helpful. So that way you're able to make associations with what you know and what you're being asked. During your test prep time, I really recommend that you annotate and take notes as you're going throughout, because it's going to help you to review the material. And so we'll talk about this a little later on how I really recommend you approach practice questions, but keep this tip in mind. Always be thinking about what you already know about the topic that you're being asked after you've read and processed the question. And then number 3, answer the question in your own words. So before you even get to the answer choices, after you have read the question from left to right, beginning to end, you have some level of understanding of what you're being asked. You've taken some mental notes about what you know about the topic you're being asked. Now answer the question in your own words. The reason I recommend you do this first is because it can be really easy once you see an answer choice to convince yourself into an answer. And so you don't want to do that on the exam. Convince yourself into an answer. You want to have an idea of what you already believe the answer should be based off what you already know about the topic. And so really try practicing this during your study time as you're answering practice questions, because it's important for you to pull on your own knowledge base when approaching the exam. And so just consider this, and we're going to practice this later on. And then number 4, this is my favorite strategy to share with you all, and I share this strategy with test takers in various disciplines. And the strategy is read your answer choices from bottom to top. Now, I know that this may seem like an odd test-taking strategy, but it is something that I really believe will help you all, and it is a strategy that I have been using ever since I took my first pre-professional exam upon graduating college, and I have utilized this strategy for every exam I've taken since then. And so why this test-taking strategy may work for you is because, number 1, it helps to reduce something called order bias, or the tendency to choose the first answer that looks right. And so our earlier strategy that I gave you that helps to also combat the order bias that can happen when approaching the answer choices is making sure to answer the question in your own words as much as you can. And then by reading the answer choices from bottom to top, it's going to help to be protective against you just choosing the first answer that looks right. And the reason for this is because reading the answer choices from bottom to top helps to disrupt your brain's natural tendency and routine way of processing. And so this causes you to engage in more critical thinking and deliberate processing of the information. And that's really why I recommend this tip, y'all. Practice it. I wish I had more science to share with you on this, but what I can tell you for sure is to practice it a few times, see how well it goes for you, and if you find that you like it, I highly recommend you approach the CNS exam with this strategy. It's something that has been working for me, and it was at the top of my list to share with you, so definitely give it a try and see how you like it. And then 5, the 5th strategy for you is to choose the best answer that answers the question being asked. Again, we've talked a little bit about bias, right? It's always best not to assume you know what the question is asking just by reading like maybe the first few words of the question stem. It's important to approach each question with a fresh set of eyes and take them at face value to see what it is that you're being asked. And then when you're coming up with your own answer to the question, make sure to be answering exactly what you're being asked. And again, we're going to have a chance to practice this when we get to the practice question slides. And then here are some additional practice tips for you to consider. And I have these tips broken up into 3 to 4 months out and then 1 to 2 months out. So 3 to 4 months out, I really believe it's important that you focus on reading through practice questions and looking up any unfamiliar terms, and then answering the question based off what you have researched and refreshed on. And so it's a little bit different than just cold question answering and trying to take a benchmark exam or a pre-test, see how much you know, and then going forth. I don't really recommend that for the CNS exam. And the reason for that is because I wrote an article on this on why I do not recommend QBL or question-based learning for the CNS exam. So I'm going to link that article below in the description. I highly recommend that you read that because it's important to understand that when you're approaching questions for the CNS exam, just the content that you know is really important. And so test taking strategies are only a portion of it, but if you really understand and know the material, it's going to be easy for you to approach these questions anyway. And so 3 to 4 months out, really focus on familiarizing yourself with unfamiliar terms and with terms that you may have forgotten about since your education program. And then number 2, I don't recommend 3 to 4 months out when you are prepping for the exam to start timing yourself. I don't think that at this stage it's the most appropriate, and the reason for that is because you can put yourself under time constraints, but if you really aren't familiar with the material, it really won't benefit you to really be timing yourself to answer questions that you really aren't familiar with the content enough to know the answer to anyway. And so I don't recommend that you time yourself at this stage. And then number 3, 3 to 4 months out, focus on making sure that you understand the content you're being asked about. Again, me emphasizing that point that understanding really is the hallmark of your CNS exam studying, and making sure that you really have a firm grip on your concept outline and what the test writers really want you to know and the competencies they want you to be familiar with that you would be able to perform in clinical practice. And so understanding really is going to be your best friend as it relates to this exam, and really being comfortable with the material. And again, the only way that this happens is really by spending time with your content outline, reviewing, reading, studying, listening to the information, and really saturating yourself in the content for the exam. So remember, having your handy dandy content outline beside you is always going to be helpful to you as you are approaching practice questions and as you're studying your content, just to keep you on track with what you need to know. All right, 1 to 2 months out, it's important to now utilize practice questions in a set with as little as 10 questions per set, and try to start taking them within one sitting. At this point, timing is optional. As you get closer to the exam, I highly recommend that you time yourself, because especially if time is one of those things that is of a concern to you, everybody is different. Here again, everybody's process for test taking and test prep is different. Some things that I did, I will share with you, but what I did may not work for everybody. So you have to figure out what you're most comfortable with. Sometimes overemphasizing this time component can cause you to be stalled and feel more stressed during your exam prep. So if you find that it's more time and it's not you understanding the material, and maybe you really understand the material and the time is what you need to work on, then try to incorporate more timed elements into your practice question time. If you find that time is not really the problem, but maybe it's more of the content, then you have to spend more time in the content to get a better understanding of maybe some things that are missing. So everybody's process is different, and just be willing to adapt and adjust, and don't make it hard on yourself. And then number 2, practice going to the bathroom before starting your question set. And I'm saying this because it just gets you trained. The exam is 200 questions, and you have 4 hours to take the exam. And based off when I took my exam and what I know of the most current protocol, you all correct me if I'm wrong, but if you take a break during your actual exam and you go to the restroom, when you come back, you're not able to get to the questions you already completed to review them. And so just keep that in mind during the 2 to 1 months out from the exam, that if you go to the bathroom, you may not be able to go back and review those earlier answer choices and things like that. So just keep that in mind. Now, obviously, for those of you who have accommodations and things like that, make sure you submit your proper paperwork to the BCNS, so that way you can be accommodated correctly and adequately to suit your needs. But that's just something I want to make sure that you all are mindful of, and practice going to the restroom before your question set, even when you're at home or wherever you're at practicing. And then number 3, make sure you take advantage of using scratch paper. Now, to my knowledge, you only get one piece of scratch paper. For those of you who have taken the exam more recently, share in the comments, let me know if you actually get more than one sheet of scratch paper. To my knowledge, you only get one, but definitely during your practice question sets, practice utilizing scratch paper if you need it. Every question won't require you to have that, but some of them that are a little bit more layered in the content, you may want to make note of certain things. And then number 4, I recommend that you take a 200 question practice exam. I say question practice exam for practice exam. That is a typo. But make sure you try to take a 200 question practice exam before sitting for the real exam. Now, before I sat for the CNS exam, I took about 169 question practice exam. And so I equated that with the time. I reduced the time that I had to take that to meet the constraints of what it would be like if it was the full length exam. And so that's how I practiced. And that may be something that's very helpful to you. I think that's probably the most responsible thing that I can tell you to do. Here again, suit everything you're doing to your preference and the type of test taker that you are. Definitely having a mock exam can be helpful to you, so consider that. And in my Core Strategies for Success Pro, I tell you what practice exam I took or what I utilized as a practice exam right before I sat for my test. If you're interested in seeing all the resources and where I got my practice questions and all of those things, check out Strategies for Success Pro. I'm linking that in the description as well. And then the 5th practice tip to consider is aim for about a 65 to 70% on your practice question sets. And this percentage is within the range of what the BCNS currently is saying is the cutoff range for passing the exam. And so obviously these numbers can always change, but on your practice question sets, definitely aim for between 65 to 70% accuracy at least. All right, and so now we're going to shift gears for a brief moment before we get into practice questions, and we're going to talk about strategies to increase your peace when answering multiple choice questions. So these tips are ones that I recommend that you practice both during practice and your real exam time, because I think that they will be really beneficial to you in helping you to be more peaceful and calm as you answer practice questions or take the real exam. Okay. Tip number 1, breathe. Take deep breaths. If when thinking about this exam and when you go to approach practice questions, if you get really nervous, just take a moment to take some deep breaths. Maybe inhale 3 seconds, then exhale 3 seconds. Take some deep breaths. I'm not giving you guys like a breath technique or anything like that, but I'm just saying that taking deep breaths can help to calm that stress response, you all. And so take a moment, take some deep breaths. One thing I will say is that the more comfortable you really get with the material on the exam, and the more comfortable you get answering practice questions, the test anxiety, and I have a video on test anxiety and I'll link that in the description as well, how to deal with that, but the less anxious you will be about this exam. When you've taken time to really understand the material, you practice enough until you're comfortable, when you approach the exam, you'll have a lot more peace about it because you've spent a lot more time, you've spent a good amount of time really making sure you understand what you're being asked. And so initially, especially in the beginning, or maybe even on test day, if you get a little nervous, get anxious, take some time to just take some deep breaths and breathe and smile. That brings me to our next strategy. And there's actually some science behind smiling and how smiling can actually be an effective way of helping to calm that stress response or the fight or flight response that can happen during times of stress, fear, whatever, anger, different emotions, fight, flight, or freeze. Smiling can actually help to calm you. And so I have an interesting little video/article that I'm going to link in the description as well if you want to learn more about why smiling can be an effective strategy to helping to increase your peace as you're practicing and then also on exam day. Number 3, embrace the challenge. Okay? It's really time to show what you know. And this phrase, "it's time to show what you know," is something that came to me during a time when I would be having to take exams and challenging exams. And this is something that I have started to frame my mind around. To get to this point, y'all, you have already taken quite a few exams, I'm sure. And so you're no novice to test taking. But when it comes to the CNS exam, I really want to encourage you to frame it in a positive way and just think it's time to show what you know. And this exam will give a good assessment to help you see, as a practitioner and then as a forever student of nutrition, areas that you are pretty sharp in and areas you need to improve in. And so obviously the exam is not a measure of your worth, your value, or even your intelligence. It's just a mile marker, and it helps to be a benchmark to show you where you are, areas you're strong, and then areas you need to improve in order to be able to effectively practice as a CNS. And then number 4, believe you can do this. Being positive is really important during this process. I know, depending on where you're coming from, if you've been out of school for a while, if you recently changed discipline and you've just gotten into nutrition, you've completed a nutrition program, and so you're progressing forward and to become a CNS, wherever you are in the process, it's really important to believe in yourself and believe that you can do this. It may seem overwhelming initially, but once you have all the information you need, you should be able to progress more smoothly forward. So really believe in yourself during this process. Be positive. Please talk positively to yourself. Please speak positively about the situation of your exam, and just allow yourself to enjoy this moment. It's fleeting, y'all. You won't be prepping for the CNS exam forever. It's definitely a fleeting moment, a fleeting time, but I really want to encourage you to take advantage of it and to enjoy it, because you will be passing and engaging on a very important milestone. And so it's definitely a mile marker in your career. It's an important exam, and it is exciting that you're taking this step forward in your professional development. So definitely give yourself some credit and believe you can do it. And then number 5, let any missed questions you have motivate you. Let them motivate you, and then let them teach you as well. Learn from the missed questions. Was it an error in understanding the question, or was it a content knowledge gap? And move forward from there. And then lastly, you can't see missed questions on the exam, just during your practice time. So just keep that in mind. But you will, once you take the exam, you will get a score report and a breakdown. You should be able to get a breakdown and see the domains you performed very well in, and then areas maybe where you can improve. Okay, so take a little breather if you need to, pause the video, and then we're going to get right into practice questions. Okay, let's talk practice questions. And these practice questions are actually from the posted BCNS practice questions they have on their website. They do not give us a study key, but I believe we'll be able to work together to answer these questions. So without further ado, I do just want to remind you about our strategies we talked about earlier. Okay, so we're going to be making sure to read the entire question, so make sure you understand what they're asking. And also, I'll link the BCNS practice questions below. I believe there is about 6 other questions, so we're going to be answering about 4 of those today. And then, so number 1, we'll make sure to read the entire question, annotate the question, answer the question in our own words. I'll give you time to do that. And then read the answer choices from bottom to top. Try it out on this practice set, y'all, and see how you do. And then choose the best answer to answer the question that's being asked. So feel free to pause throughout this time, and we're going to move forward. Okay, so compared to the requirements of a non-pregnant adult woman, the dietary requirements for several vitamins are increased during gestation. Among these are the requirements for, Okay, at this point, you can take a moment to pause it, come up with your own answer choice, and then when you're ready to proceed, we're going to break down the question. Okay, so here we read the question in its entirety, and it's important to make sure you have an understanding. And from what I read, there were keywords that stuck out to me. So we're making a comparison between pregnant and non-pregnant women. And we're looking at the dietary requirements for several vitamins, which are increased during gestation. Among these would be what vitamins? I want you to think about what vitamins come to mind that are increased demand during pregnancy. Think about that. And I gave you time previously to come up with your own answer, so I'm going to show the answer choices and we're going to talk through them. Okay, so here are the answer choices that we have to choose from. Okay, and so we're going to talk through these answer choices, beginning with vitamin D. So let's do a little review on vitamin D. Now, the standard recommendation for pregnant and non-pregnant women for vitamin D are the same. Right off the bat, we would know that's not the correct answer, but let's do a little review of what vitamin D does. Some claims to fame. Number one, bone growth and development. So we know that vitamin D helps us to absorb calcium. Oftentimes, vitamin D3 is supplemented with vitamin K2 to help the calcium then get into the bones, right, to promote healthy teeth and to promote strong bones. And so during gestation for both mama and baby, this is important, especially for developing baby in utero. And so vitamin D is also important for aiding immune function and healthy cell division, and it helps to reduce the risk of mom developing gestational diabetes, preeclampsia, and low birth weight for baby. So vitamin D is very important. Let's talk thiamine. So right off, so especially for the B vitamins, because they go by different names other than just B1, B2, B3, it's important to make sure that you know the correct names for them. So if on the exam they say vitamin B1, but they don't say thiamine, it's important that you know that vitamin B1 is thiamine. And then riboflavin, it's vitamin B2. And then niacin is vitamin B3. So make sure you know both names for those vitamins. So let's talk about thiamine. And so thiamine is one of those vitamins that right off the bat, I always think, okay, essential for carbohydrate metabolism. And then also what comes to my mind is those who have battled or dealt with chronic alcoholism, they're very low in vitamin B1 and is a contributing factor to Wernicke-Korsakoff syndrome. So those are the things that come to my mind. Now, what does that have to do with gestation? The part that really pertains here is really looking at the way that thiamine is important for that carbohydrate metabolism. And so it is also important for aiding cellular energy and healthy brain development for baby. So that is what is pertinent as it relates to pregnancy. And I actually found a great article on thiamine deficiency in pregnancy. It has really great diagrams and it does a little bit of SNP review, so getting more into like nutritional genomics. And it's just a really great overall article. Also goes over a little bit of biochemistry that will be helpful for you on the nutritional biochemistry section. So I'm going to link that article below. It's a really great article. I suggest you read it. It definitely goes into more detail than what you necessarily need to know for the exam, but it is a great review on vitamin B1. And so I'm going to link it below for you all to view in your own time. And then let's look at vitamin B2, riboflavin. And so riboflavin is really important for maternal eye health as well as skin health, and then overall energy production as well. So we talked about earlier, the B vitamins are really important for metabolism, and they all really like to work in concert with one another. And so, particularly during the time of gestation, there are heightened metabolic demands for both mom and baby. And so, riboflavin is important for the baby to develop normal vision, healthy skin, and also energy production as well. Moving right along to niacin. Niacin is important for helping to promote healthy digestion, normal metabolic function, and also skin health. And so it is also helpful in preventing nutrition-related birth defects as well. And so one thing to know about niacin is that out of the vitamins listed, it actually has the greatest difference between pregnant and non-pregnant women in the amount that is required. So that's a little interesting fact. Okay, and then we're going to move right along to pyridoxine and pantothenic acid. And so here again, it's important to make sure you understand that pyridoxine is vitamin B6 and pantothenic acid is vitamin B5. I know throughout my studying and even now I have to always remind myself of those because those two, in my opinion, can be like, they're not tongue twisters, but they're just like the similarity of the names. And then so keeping that straight, I always have to remind myself, okay, pyridoxine is vitamin B6 and pantothenic acid is vitamin B5. So make sure you have those straight and that you understand which is which. And then particularly for pregnancy, there are a little bit increased demands for these between pregnant and non-pregnant women. And so what pyridoxine specifically helps in, and I took notes, you all, because I don't have this, I had it memorized when I took my exam, but specifically for pregnant women and the facts concerning that I did not have memorized. But pyridoxine helps to support the baby's brain and nervous system development, and it frequently helps to reduce pregnancy-related nausea and vomiting. And so here again, these both are B vitamins, so they're important for metabolism. And pyridoxine also helps to power the baby's brain and nervous system. Pantothenic acid, on the other hand, helps to assist with steroid hormone synthesis. So specifically, it's helping to generate cortisol, progesterone, and DHEA, and it also may help minimize maternal leg cramps as well. And as we're looking at this, it's really beneficial. It's looking like for mom to make sure she has enough pyridoxine and pantothenic acid, as it helps to reduce some of those symptoms related with pregnancy. And so that's important to note. And then answer choice A, vitamin A. Now, vitamin A is important and it's crucial for cellular growth, vision, and immune function. However, too much of preformed vitamin A retinol can cause birth defects. So women have to be careful with that. And so while the demands for vitamin A are a little bit higher in pregnant women than non-pregnant women, it's still very important to make sure that a woman is not getting too much of preformed vitamin A when she is pregnant. The best answer choice here for this question would be answer choice C. And I hope you all, since we were able to talk through those choices, you may have to play this portion of the video back, are able to see that when it comes to gestation and really ensuring that the metabolic demands are met for specifically baby, but also mom, these 3 B vitamins are essential and very important, and they do have increased demands during pregnancy. So I recommend that you review the specific numbers on these and reference your current dietary guidelines on that as well. Okay, so practice question number 2. Insulin sensitivity may be enhanced by supplementation with. So I've highlighted some keywords: insulin sensitivity, enhanced, and supplement. We're looking at probably some form of a physical supplement that they can just take to help improve insulin sensitivity. And so what comes to mind for you here? What vitamins, what minerals come to mind when you think of insulin sensitivity? So here are your answer choices, and we're going to talk through them. Okay. So right off top of mind for me, when I think of selenium, my mind goes straight to glutathione peroxidase. So excess selenium actually can even adversely affect glucose metabolism, and it's not really one that we typically consider to be a nutrient or a mineral that's going to help improve insulin sensitivity. That's not really its claim to fame. And then zinc chloride. Now, in all these answer choices, y'all, what we're really looking at is that first word in the first word in the name. And so hexanoate, chloride, acetate picolinate, that's not really pertinent to answering this question. I would consider those a little bit distracting, and you could X those out and just pay attention to the first name. And so zinc in particular plays an important role in insulin synthesis, meaning that it plays an important role in the production of insulin, storage, and secretion within the pancreas. However, zinc supplementation is not the classic nutrient we would consider to be the most helpful in improving insulin sensitivity. Typically, when we think of zinc, we're thinking of immune function. And then iron. Okay, so again, we're not really considering the acetate part. We're looking really at the major function of iron. And we know that iron is essential for oxygen transport and numerous enzyme functions in our body, right? So think iron deficiency anemia, we're thinking blood, not typically thinking insulin resistance. That's not really the claim to fame here. And then for the final answer choice, and I'm not sure about you all at this point, how you've been studying your vitamins and minerals, but it's really important to pick like your top 5 claims to fame for each of them. And I believe this will help you to learn them a lot more effectively. But for me, one of my claims to fame for chromium was helping to improve insulin sensitivity and helping to play an important role in carbohydrate metabolism. And to answer this question, the best answer choice would be A. And an interesting note about chromium is that deficiency for chromium is rare, except in the case for patients who are receiving TPN or total parenteral nutrition or IV nutrition. And that's because the solutions are often missing trace minerals. And so that's just something that's important to note as far as those who have to be on long-term TPN IV nutrition. But the best answer choice for this question would be A, chromium picolinate. Okay, practice question number 3. Initial advice for a lactose-intolerant postmenopausal woman with a history of kidney stones and subnormal spinal BMD. Let's look at keywords. Lactose-intolerant, postmenopausal, okay. History of kidney stones, okay. And she has a subnormal spinal BMD, or bone mineral density. Okay, so let's think. What do you know about postmenopausal women? What are some common conditions associated with that stage of life, if not being met through nutrition and lifestyle? Lactose intolerant. Okay, history of kidney stones, and then a subnormal spinal bone mineral density. Okay, let's talk through these answer choices. So letter D, dietary supplementation with magnesium. Now, magnesium is one of my favorite minerals, y'all. I call it a super mineral. And as a nutritionist, whether you have just came out of school or maybe you've been in practice for some time, one of the things I learned when I was in my master's program was that magnesium is something that we as nutritionists like to recommend for various conditions. We like to recommend it for better sleep, easing muscle soreness, if you're someone who's active and works out, helping with digestive issues, easing cramps. Magnesium is a super mineral and does so many things in the body. It's involved with various enzymatic processes in the body, and so it is a super mineral. Now, as it relates to answering this question, so we're looking at, and I really should have emphasized initial advice as well, but initial advice, the first thing we would tell a postmenopausal woman who is lactose intolerant, so there's a chance that she's fretful of dairy, she is postmenopausal, so the protective effect of estrogen as it relates to bone bone regulation, so the building up and the normal breaking down of bone to help us maintain a normal bone density. The protective effect of estrogen as it relates to bone health is most likely lacking due to the fact that she has a subnormal spinal BMD. Okay, so that's what we're looking at. And so would the initial advice be to supplement with magnesium? Maybe not, but it definitely could be on the list of recommendations because magnesium helps the body to absorb various nutrients. So it could be one of the recommendations, but at this point, would it be the very first one that we recommend for her? Maybe not. And then answer letter C, increase consumption of dairy products. Okay, so when we're thinking about personalized care, this woman may have developed an aversion to dairy because of the fact that she's lactose intolerant. And what many people don't know, and this is often a point that has to be explained as a nutritionist, as a healthcare practitioner who understands this, is that there's a difference between a dairy sensitivity and then a dairy allergy. And it's also some confusion around whether or not if someone who's lactose intolerant should have any dairy at all. And so the truth of the matter is that there are products that are lactose free that those who have lactose intolerance can consume. Now, lactose intolerance, I don't know if you all know, but I read an interesting article in my master's program about this, is that most adults are actually lactose intolerant. Particularly, it's a normal response or development for most individuals, particularly after the time where we all stop getting breastfed. Just less of the lactase enzyme is made by our bodies. And so there's actually a disparity in race on this as well. And I'll let you all do your own deep dive into that. The exam does not go into this, so I'm not going to spend too much time on this, but it's very interesting. And so the body just naturally produces a lot less lactase, therefore causing a lot more people to be lactose intolerant. And so I say all that to say that dairy can be consumed by those who are lactose intolerant. It is just wise to make sure that they consume lactose-free dairy. Now, I'm not promoting dairy or saying it's good for everyone at every stage and phase of life. That's not what I'm saying. But to answer this question and to address maybe some misnomer and some confusion for the client at hand, it's really important to explain that she will be able to consume lactose-free dairy, and this could possibly help to improve her intake of calcium. So, even though C would appear to be counterintuitive, let's leave that open as an answer choice. Letter B, restriction of fluid intake. Okay. If there were no other answers, that would not be the right answer. Restriction of fluid intake. Just based off the information we've been provided and the answer choices so far, that would not be the best answer choice. And then letter A, restriction of dietary calcium intake. Okay, so our client here has a subnormal spinal BMD. So she does not need to have her dietary calcium intake restricted. Yes, she has a history of kidney stones. And yes, a component of the kidney stone can be calcium. But actually, calcium deficiency can contribute to the development of kidney stones. So restricting calcium for this client or patient would not be the best. So we're back to answer choices D and C, and for this question, the best answer choice would be letter C. Increased consumption of, to be more specific, lactose-free dairy products. That would have just gave it away, so I can see why they left lactose out. But increased consumption of lactose-free dairy products. And it should be a lactose-free recommendation, because if not, it's going to give our client and our patient some digestive discomfort that would be counterintuitive to our purposes. To help her increase her intake of calcium, we would recommend that she consume lactose-free dairy products. Okay, practice question number 4. If a bolus containing 600 milliosmoles per liter enters the jejunum, the net direction of fluid movement in the intestinal tract will be, okay, highlighted some keywords here, 600 milliosmoliters, okay, enters the jejunum, that's our small part of our small intestine. The net direction of fluid movement in the intestinal tract will be, okay, so I have our answer choices up already here, and we're looking at the net direction of fluid movement in the intestinal tract. So here's what I want you to keep in mind, y'all. The intestinal tract is semi-permeable, meaning that certain particles of a certain size can flow across that barrier. So keep that in mind. It is not completely solid. There, certain nutrients can pass through the intestinal tract. Okay, so it's semi-permeable, right? So let's start with our answer choices. And I want you to also be thinking about where water moves in the presence of a solute. Okay, so letter D, letter D, so from the circulation to the lymphoid system. Okay, so circulation to lymphoid system. This particular question is not asking anything about the lymphoid system. So we're just going to put a question mark there. And then number C, longitudinally along the mucosal basement membrane. Now, I have to be honest, when I first answered this question, I got it wrong because I was thinking of the movement of fluid and nutrients down the digestive tract, but that's not what the question was asking. It was asking the net direction of fluid movement in the intestinal tract in consideration of the fact that a 600 milliosmoliter bolus just entered the jejunum. So as a result of this, what is the direction of fluid movement inside of the intestinal tract? And so then letter B, from the circulation to the intestinal lumen. And so water likes to flow where there's higher levels of solute. Okay, so wherever the water is least concentrated, it likes to flow there. And so after a bolus containing 600 milliosmoliters, so that's a concentrated solute bolus that just entered into the jejunum, water is going to want to flow into the jejunum to break that up, to reduce the solute load or the concentration of the solute. So water likes to flow down the concentration gradient. So wherever the water is highest, it likes to flow to where it is the lowest, which is, in this case, it would be lower inside of the intestinal tract. Okay, and so answer choice A says from the intestinal lumen to the circulation, water is not going to flow where it's less concentrated to where it's most concentrated. It's going to flow to where there's less of it to break up something that is already more concentrated. So I hope this makes sense, y'all. And if there's any questions that you have, if there's any questions you have a question about, leave it in the comments and we can chat there. Me or one of our peers will chat and respond to help you understand it better. If you have anything to contribute or comments you would like to make concerning this video, concerning the questions, content, or strategies, please leave me a comment below and I'll be sure to get back to you. Thanks y'all so much for tuning in today. Stay tuned for your prep note at the end of this video. And as always, y'all, it's time to prep like you mean it. You can do this.